So welcome to the Health-Edu platform. I'm Dr. Emmanuel Dusabe, prosthodontist and dental implant surgeon. Today I'll be talking about the prosthodontic rehabilitation of missing teeth by dental implant. So what is dental implant? Dental implant, it is a tooth root, replica or root form made of titanium fixer, so which is inserted into the jaw to act as a tooth root, and it will anchor a restoration like single crown, bridge, or denture. History of dental implant. In 1952, a Professor Per Ingvar Brennemark, a Swedish surgeon, while conducting his research into the healing patterns of a bone tissue, accidentally discovered that when pure titanium comes into direct contact with the living bone tissue, the two literally grow together to form a permanent biological adhesion known as osteointegration. So what are the parts of dental implants? Dental implants has got three main parts: prosthesis, abutment, and implant. Implant is the parts which is surgically pressed in the human bone, and the crown will be attached to the implant by another component known as abutment. So as you can see on the next picture, there is a difference between an implant and a natural tooth. So the natural tooth itself has got a periodontal ligament, but the implant does not have an periodontal ligament support. It is only fused to the bone by what we call osteointegration or fibro-osteointegration. You can see screw, abutment, crown. Yeah. So why we recommend people to have a dental implant? The answer is they replace missing tooth roots and form a stable foundation for the replacement of teeth that look, feel, and function like natural teeth. Dental implants also help preserve the remaining bone by providing the stimulation previously provided by the natural tooth roots, and the implant also may prevent the future bone loss. The bone that disappears when a tooth is removed can only be replaced by a bone graft, so which is an artificial tooth material to cover the implant. Advantages of dental implants compared to a removable denture or dental bridge. The implant replaces one or more teeth as a single unit. Implants support a bridge and eliminate the need for a partial denture. They provide support for denture, making it more comfortable compared to removable denture. Implant prevents bone loss and gum recession. They enhance patients' confidence in smiling and speaking. They improve overall psychological health, as well improve the aesthetic appearance in the teeth and the mouth. In summary, about the advantage of dental implants is that this option to replace missing teeth in Rwanda or elsewhere in the world is that it maintains anatomy, because once you have missing teeth, the bone begins to shrink over the time. Unhealthy bone loss can make your jawline to recede and change your facial structure and cause drifting, shifting of the other natural teeth. Dental implants can help prevent deterioration of the jawbone, so your face retains its natural shape. Implants keep your healthy teeth. In many cases, a better long-term alternative to the bridge work. This option eliminates the need to grind down your healthy teeth when replacing one or more adjacent teeth. Your own natural healthy teeth are not compromised, like choosing a dental bridge. Security. The implant securely anchored into the bone do not slip or move. They stay there permanently as they fused with the living human bone. This eliminates some of the key problems of denture, including poor fit, gum irritation, and pain from the exposed nerves. The result is superior comfort reliability, and freedom from the embarrassment. This is the advantages of dental implants. They are designed to be permanent, not temporary. They preserve the bone. They don't damage adjacent teeth. They look, feel like natural teeth. They improve appearance of the patients, as well improves the patient self-esteem, as you can see on the picture. The following is an image showing how stable and secure implant are from the ENABEL Christian Academy. The implant is using the bone. The abutment connecting the crown to the implant also is stable. So all this is all about advantage of dental implant, as you can compare to the removable denture or dental bridge. So what are the contraindications to the dental implants treatment? We have general contraindications to the dental implant therapy: bone disease, endocrinological disease, disease of the hematopoietic system, therapy-resistant cardiovascular disease, disease of the rheumatic spectrum, malignomas, permanent disorders of the immune system, allergic diathesis, suspected focal infection, psychiatric illnesses, lack of willingness to cooperate. Local contraindications: recurring mucosal diseases of the mouth, osteomyelitis, unfavorable anatomical condition, large vertical gaps in the jaw rims, therapy-resistant parodontopathies, mandibular joint complaints, parafunks, macroglossia known as large tongue, radiotherapy in the maxillary and neck area, as this kind of the treatment may affect the bone, causing bone necrosis. So it is a local contraindication about dental implant placement. Insufficient oral hygiene also. Types of classification of dental implants. Dental implants mainly are classified in 5 types based on the implant tissue placement. Second, based on the attachment mechanism. Third, based on the macroscopic body design. Fourth, based on the surface of the implant. Fifth, based on the type of the material. Based on the bone and the tissue level placement, we have 3 subtypes. We have the endosteal implant, chemigene incide. We have supraperiosteal implant, chemigene uncide, and transosteal implant, chemigene buyunsa. By the attachment mechanism, we have osteointegration and fibrointegration implants, only 2 types. Based on the macroscopic design, we have 6 classes according to this design. We have cylinder implants, thread implants, proteus implants, perforated implants, solid implants, and finally hollow or vented implant. Based on the surface of the implant, we have 4 types: smooth implants, machined implants, textured implants, and coated implants. Based on the material, we have ceramic and the metal dental implants, as you can see on the picture. Industrial implants are the commonest type of dental implants utilized by clinicians even in Rwanda. And we have 3 types: cylinder one, screw, root form, and the combination. And regarding the root form implants, they are mainly used when there is a vertical column of the bone missing. And platform implants, they are used when there is an horizontal column of bone missing, like bone resolution, but at the horizontal point of view. So when the patient is missing horizontal bone and the bone has been resolved horizontally, the platform implants are more advantageous compared to the root form implants. But the root form implants, especially when there is a vertical bone loss, these are the best type of implants to be placed. Surgical placement of dental implants, like the surgery phase, how is it done via surgery? So we have 4 main steps. Initial surgery. Step number 2, osteointegration period. It's a period between placement of implant and the fusion of the implant. Abutment connection is the third phase, when you're going to connect the artificial crown to the dental implant. Then the last stage is final prosthetic restoration, which is the delivery of the crown to the dental implant. Clinical assessment. Every treatment planned, we have to assess the chief complaint and the expectations from the patient. We as well review the all restorative options, whether the patient will have a screw retained crown or cement retained crown. Cement retained crown, the crown will be retained to the dental implant by a cement, while the screw retained crown, the artificial crown will be retained to the implant by a screw. We also have to assess the risk and the benefits of every restoration. We have also to select the options that meets functional and aesthetic requirements of the patient. Patient evaluation, medical history, about if the patient has a medical condition that might allow us, or that might contraindicate to the post-treatment. Vascular diseases, disease of the blood vessels, immunodeficiencies, diabetes mellitus, tobacco use, and bisphosphonate use. These are the type of medicine used to treat some bone conditions. So it's contraindicated to make implant therapy in this kind of the patients. History of the implant site. Factors regarding the loss of the tooth being replaced should also be put into consideration. When the tooth has been lost, how the tooth was lost, and why. So factors that may affect hard and soft tissues, factors affecting like traumatic injuries. If the patient has had a root canal treatment, the reason why it has failed, and then periodontal disease, those are diseases that affect the gum and the bone. And also we have to indicate the ridge deficiencies, if it is the horizontal or bone loss. Surgical phase treatment planning, we have to evaluate the implant site. Is it going to be placed anterior or on the back teeth, back region? Radiographic evaluation, bone height, bone width, and anatomical consideration. Basic principle, soft and hard tissue graft bed. You should consider if you are going to graft soft tissue like the gum to cover the implant, or if you are only going to graft the bone on the same patients, and then this bone grafted from the same patient is going to cover the implant defect. Existing occlusion, how the patient teeth meet simultaneously versus delayed reconstruction. Are we going to put an implant after extraction, or we have to wait till the wound will heal and then we place the implant maybe after? All these factors, principles also should be looked at. Smile line, one of the most influencing factors of any prosthodontic restoration. If no gingiva shows, then the soft tissue quality, quantity, and the contour are less important. Patient counseling on the treatment expectation also is very critical. So what are the anatomical considerations during the implant therapy? Ridge relationship, attached tissue, inter-arch clearance, inferior alveolar nerve, maxillary sinus, and the flow of the nose. Radiological imaging types used during the implant treatment or before the implant therapy. We have periapical radiographs, panoramic radiographs known as orthopantomography, site-specific tomographs, CAT scan or dental scanner. We have the cone beam computer tomography known as a CBCT, which is a 3D radiographic modalities. So other anatomical limitations of the buccal plate should be 0.5 mm. For the implant placement, lingual plate, you should leave 1.0 mm. Maxillary sinus, you should leave 1 mm. Nasal cavity, 1.0 mm. Incisive canal, 1 mm. Inter-implant distance should be between 1 to 1.5 mm between adjacent implant. Inferior alveolar canal 2.0 mm, mental nerve 5 mm from the foramen, and inferior border 1 mm, adjacent to the natural tooth 0.5 mm. Here are the basic armamentarium instruments to use during the implant placement, as you can see. These are the different names of the instrument: periosteal elevator, tissue forceps, sutures, material, bone fill, calipers, cheek retractors, cotton pliers, DNA tissue sizers, dental curate, disposable punch, gauze sponges, emulsifier, high-speed surgical handpiece, implant placement kit, local anesthetic with vasoconstrictor, Minnesota retractor, mouth mirror, needle holder and suture, periodontal probes, longer, scalpel handle, size number 15 or number 12 blade, suction tip, torque wrench, variable speed implant drilling units, and some tongue retractors. All of these constitute the armamentarium to be used during the implant placement. You can see the standard about the implant drills on different size, starting from D1, D2, regarding the implant size, available bone. All these are the drills used during the implant placement. You can see the surgical kit used during the implant treatment. These are the summarized steps about the dental implant. As you can see on A is the soft tissue exposure, graft of the tissues. B is the initial drill. We start drilling into the bone, expansion of the drills. On the D, the implant is already placed into the prepared osteotomy. E is the temporary crown. On this F, it was soft tissue stabilized by sutures so that the food debris and the other materials cannot be in contact with the implant. Then H is the final crown delivered. Yeah, these are the summarized steps from the final crown delivery. You can see on the single tooth implant restoration, this patient was missing a maxillary left first molar on the OPG X-ray. On the picture number B, it's the space, the empty space with missing tooth. You see how we exposed the soft tissue, how we placed an implant. You can see the very small healing abutment on that black filling. The sutures have been placed to cover the wound and the implant. And finally, you can see these are the summarized steps used during the implant therapy on the patient who was missing a maxillary left first molar. Very clear. Missing mandibular left first and second molar restored by dental implants, single crowns of ceramic. We have used the screw retaining types. You can see on the image number 1, the patient is missing the lower molars, 2 lower molars. Step number 2, the implant all fit into the bone, osteointegrated, fused anatomically and histologically fused with the bone. On the image number C is the time to deliver the crowns. You see the crowns have holes inside. There will be screw retained crowns as zirconium type. You can see on the last image on D. These are the steps: how soft tissue exposure, initial pilot drill extension, implant placement in the prepared bone, temporary crown to stabilize the tissues and the occlusion as well, sutures placed, and the final temporary crown to stabilize soft tissue, and the final semi-crown of the implant. What are the complications related to the immediate placement and loading? When we say immediate loading, you do extraction and then immediately you place an implant. So among these two complications, we have poor implant position, marginal bone loss, peri-implant soft tissue recession, compromised aesthetics, failure to attain the primary stability, which may lead to the implant failure. We have the ERA complications and the delayed complications associated with dental implant. Among ear complications, you have infection, edema, ecchymosis and the hematomas, emphysema, bleeding from the implant site, flap dehiscence, sensory. Among the late complications, we have perforation of the mucoperiostome, maxillary sinusitis, mandibular fracture, integration, bone defects, and periapical implant lesions. You can see on the following image about even the book written on prevention and management of complication in implant dentistry. It's an evidence-based medicine dentistry from the Cochrane, the famous institute that surgeon and implantologists in the world. You can see about swearing, ecchymosis, all are the complications that may follow the implant therapy, either immediate. Planned in dentistry should have, so implant also treatment needs to have regular maintenance parameters to follow during the implant maintenance. Or calculus. We should also clinically detect the peri-implant. We have to radiographically check the appearance of the implant structures, signs of cement, if the cement retained crown have been used, retain less into the subgingival calculus, and you have also to look for stability of prosthesis and implants. We have to measure how many millimeters, occlusal evaluation, presence of bleeding or patient comfort, and then we schedule 3 to 6 months to the implant placement and 3 years and 5 years ahead. So this is maintenance evaluation parameters. You can see on the gators water flosser. This water flosser device is highly recommended when the bacteria or microbes implant. So the water floss will take away all debris and bacterial components away, and then the aeration and oxygen may transverse, may circulate within the tissues surrounding the implant. We may also use non-alcoholic antimicrobial rinse. It's the very strong disinfectant which will kill that may cause the infection within the implant. You can see about the water flosser, how implant surfaces, how it is thoroughly and comprehensively, and the naturalities as well. Dental implant hygiene, maintenance strategies. Maintenance phase, we have to probe the implants, but not using metal devices because they may scratch the chemical or biological or damage to the implant. So we have to use the plastic devices as they may not affect the implants. Conclusion, dental implants and dental natural tooth tissue by avoiding the need to cut down adjacent teeth, bridge work. They also preserve the bone as well deterioration that may result in the loss of the. However, good planning and case selection remains very important here. These are the references used, implants, and I here suggest about the essentials of periodontics and oral implantology. It's one of the book published by very nice book, so it can help clinicians and the other doctors a lot from the implant therapy. I thank you very much for today's presentation platform. So see you soon during the practical sessions and the other sessions. I thank you in advance. Have a good day. Dr. Dusabe Emmanuel.